Pull up a chair and get comfortable. It's time to talk about your federal benefits. Federal Employee Benefit Coordinators presents the FEBC podcast with Elizabeth Inman and Brian Fentress.
Elizabeth Inman here, a retired postal employee working as a Federal Employee Benefit Coordinator now. Own my own company. Happy to be here to help and bring information when I can. Love what I'm doing because this information is important to you. It's important to you and it's important to me personally. This stuff is good stuff and I want to share information as it's happening. So the ongoing saga that will be foremost in front of us for the next 2 years anyway, at least through 2025, they're changing health benefits for postal employees. Eventually, there will be some changes for federal employees because they're going to change the platform in which it's all administered. It's going to go to a cloud-based program. So don't think that won't impact you. And I'm going to tell you that's just the tip of the iceberg if you're a federal employee. Get ready. Medicare changes, health benefit changes, and we're going to discuss it all here on our podcast. And you can find it as well on Facebook, LinkedIn, YouTube. Just look for Federal Employee Benefit Coordinators. That's who we are. Started this company after I retired because I was very, very, very hard-pressed to find the information I needed to make good information when I got ready to retire. Now let's talk about something before I get into our next postal fact about the Postal Service Health Benefit Plan that's coming up. We've always had the option at retirement, once we reached Medicare age, to suspend our Postal Service health benefits. Now, it's currently called Federal Employee Health Benefit Plan. That's what we're currently covered under. There will come a time, January 1st of 2025, when it's going to be called Postal Service Health Benefit Plan. You're going to want to understand what suspending coverage is. Oftentimes we think that we either have coverage or we don't. We don't really understand that what if we decide we want to do Medicare only? That means Medicare A, hospital coverage, Medicare B, which is medical services, Medicare D, which covers the prescription drug plans, and a supplement called the Medigap plan. What if we want to go that route? And because now we're being forced into Medicare B coverage as a retiree, maybe we don't want to pay for our federal plan on top of it. But the future is murky. The future is not so clear-cut as it used to be. Because it used to be, if I made a decision to go a certain way with my health plan, I understood how it intertwined with Medicare. Not so much anymore. Everything's changing. I don't have a clear-cut path that I can get on a podcast or on a video and tell you if you make this decision on your health plan, this is the way it's going to be for the next 20 years. Or if you make a decision on Medicare, this is how it's going to be and how it's going to interact with the federal plan. I can't do that because there's going to be a brand new Postal Service Health Benefit Plan. And they're already saying that if they're successful with the Postal Service Health Benefit Plan, some of the changes they're making there, they may make permanent with the Federal Employee Health Benefit Plan. What if they all of a sudden enroll all these new postal employees into Medicare Part B, and now they get new enrollees into Medicare Part D? How's that going to impact premiums for Medicare? What if the premiums go up way, way, way high, and I dropped my Postal Service Health Benefit Plan because I was going to go fully Medicare? But the premiums go up so high I can no longer afford it. But I dropped my Postal Service Health Benefit Plan because I didn't know I could suspend it. You catch my drift? Do you understand what I'm saying? You need to understand that you can suspend your benefits and not drop your benefits if you qualify. Way too much information that I can share it in a little 10-minute podcast. But I can drop information, I can plant the seed so that you know you need to do more research. You need to be hooked up with a company that is trained in these topics that will get the proper information to you to make educated decisions. I started my second career, Federal Employee Benefit Coordinators. I started that company. It's my company because I got surprised by a lot of things in retirement. In fact, I have training that I call the 5 surprises of federal retirement. Who wants to retire to be surprised? We should eliminate those surprises, right? Well, they don't even have the education plan available to us yet to educate us on what the Postal Service Health Benefit Plan is going to look like yet. We know it's upcoming. We know the promise is they'll get the information. They've told us that by October of 2024, prior to open season, they'll get what plans are available, what the premiums will be, and what the payouts will be. They're going to give you a whole month. How's that make you feel? Warm and fuzzy that you're going to be fully educated? We just got to band together. We got to come together as postal employees, postal retirees, and we got to get all of the information we can have under our fingertips to make the best decisions we can make. Education is power, and that's what we are here to provide you here at Federal Employee Benefit Coordinators. So, just wanted to share with you to keep in mind that you have the ability, under the proper conditions, and if you're eligible, to suspend benefits rather than drop benefits if you are retiring as an annuitant, as an immediate annuitant, as a postal employee. Important information. Let's move on to the next fact about this Postal Service Health Benefit Plan that's getting ready to come out. Now, in the earlier podcasts, I talked about when we were going to be required to select it. Open season of 2024. I talked about when the premiums and payouts and what plans are going to be available. I have told you that you may have a plan today that won't be available under the new Postal Service Health Benefit Plan. We won't know that until October of 2024. I've talked about if you're an active employee, age 64 or older as of January 1st, 2025, if and when you're required to enroll in Medicare Part B. And today I'm going to talk about some exceptions to the requirements. So listen up, get a pencil and paper ready, and I'm going to tell you why this is important to you if you're a postal employee or a postal retiree. So you ready? Okay, I'm going to read the exceptions because when it's very, very important information, I want to be very specific with you. There are exceptions to the requirement to enroll in Medicare Part B as an annuitant. These exceptions will also apply to your covered family members. Annuitants may be responsible for providing proof of eligibility to the applicable exceptions to the designated agency. Now remember, annuitant means you're retired drawing a pension. These exceptions are: you are residing outside of the United States and its territories. You're required to follow the policy and procedure set forth by the Postal Service to be eligible for this exception, or you're enrolled in health care benefits provided by the Department of Veterans Affairs, or you're eligible for health services provided by Indian Health Services. Those are the exceptions. So I listed those. There are 3 exceptions, and those are for annuitants. In other words, you're a retiree drawing a pension as a retiree. So you can get this information available on this podcast, or you can call us. You can email me, elizabeth@febcnow.com. My website's www.febcnow.com. There's lots of other information on that website. Look us up on Facebook, LinkedIn, YouTube, and don't forget to subscribe to our podcast. Hey, and here's the other piece of this. Share this information with your friends. Get your friends to subscribe to these podcasts. The network that we have with one another is the best source of information we have to share information, and I appreciate you sharing our podcasts. Look forward to our next one. We'll wrap this all up on postal employees on our next podcast, and right after that, we'll start the podcast that will be specifically for postal retirees, annuitants that are drawing a pension from the Postal Service, and how the postal reform that that creates the Postal Service health benefit plans are going to impact our retirees. That will be our next series that will start coming up soon.